Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here. Today I want to talk about the lymphatic system and HRV and how those things are intertwined and how you can actually improve your HRV, which is your recovery, through lymphatics. So I'll just give a kind of quick overview of those systems. So the lymphatic system is all of your body. So basically it's sort of analogous or in parallel to your vasculature. So you have arteries and veins. You tend to have lymph vessels that ride alongside. And then you have these sort of collection areas. There's like 6 main ones of the lymphatic system. It's your your neck, your clavicle area, your armpit, your abdomen, your groin, and behind the knee. It's a very superficial system, meaning it's kind of just underneath the skin. So lymphatic drainage or lymphatic massage, you may call it, is very light massage because you don't have to press deep. And it's not like a deep tissue massage. So it's very easy to stimulate the lymphatic system. In fact, I kind of have this theory, and this is going off topic already, that ticklishness is really your body's way of protecting sort of key parts of your lymphatic system. So if you think about it, like I just said, light touch is all it takes to stimulate it. And what are the areas? Like your neck, your armpit, behind the knee, like stomach, like those are all very ticklish areas. I think there's a reason for that. So the lymphatic system is sort of known as the sewage system of the body, which is an oversimplification, but it does handle swelling and mitigate swelling. So when you have an area that gets inflamed from an injury, for example, the lymphatic system sends inflammatory like cytokines and things to inflame the area to help it heal, and then you get waste over metabolic waste essentially. And then the lymphatic system is responsible to clear that. So that's why it's kind of known as the sewer system. The key difference between the lymphatic system and the vasculature is the vasculature has a pump known as your heart, whereas the lymphatic system requires the action of muscles, so the pumping of muscles to squeeze fluids back up to your chest where it needs to drain. Now, the lymphatic system and the autonomic nervous system are intertwined because the immune system is what triggers, or the nervous system is what triggers an immune response, which is basically housed in the lymph. The autonomic nervous system has 2 branches, the sympathetic, fight or flight, and the parasympathetic system, which is the rest and digest. And these have a direct role in what the lymphatic system does. And just to tie this together quickly for an overview, HRV is a measure of your autonomic nervous system to see how it's doing. Right? So basically the higher the variance, so heart rate variability, the variance between the beats of your heart, the more parasympathetic you are, and the more engaged or more sympathetic you are, the more consistent your heart rate gets. So you can tell what state you're in, and you can also tell how recovered you are by your HRV scores. When you're in a sympathetic state, things tend to be more constricted. Right? The vascular constricts, and so does the lymphatic system. And when you're parasympathetic, things tend to dilate, like the vasculature and also the lymphatic system. Since so many of us are basically in a chronic stress state, it's generally a good idea for most people to seek parasympathetic activity to improve your HRV scores, which also improves your recovery and keeps you away from injury. Because basically what happens is people, are stressed. They train, which is a form of stress, and maybe they plunge in sauna, and that's more stress, and they don't sleep, and that's all these things that add stress to the bucket. And then they don't have time to recover, and they don't get the adaptation they want, which is to get stronger or faster. But what happens instead is they run into injury, pain, and sometimes even getting sick. When you get a lymphatic massage, or drainage is the technical term, it's very relaxing. It's very light touch. It feels good. A lot of people fall asleep during it. So it's a very parasympathetic behavior. And I've watched people's HRV scores go way up right after a lymphatic drainage session. So when do we use lymphatic drainage? I mean, the short answer is anybody can use it at any time. It's sort of conventionally ordered after surgery. So when you have like lymphedema. So what happens there is, say you just had a knee replacement you could develop sort of a blockage in that collection tubule of the lymphatic system behind the knee. And, over time it should improve, but sometimes having someone manually sort of flush that area out can really help restore normal flow of the lymphatic system. And what I see often is when you have someone who's had multiple procedures, like I had one woman who had double breast mastectomy and a knee replacement and I think a hip replacement, that's just more insult to the lymphatic system. So then it's easier to get sort of chronic full system backup. And it's kind of like having a rock in a river. Like the water will still flow around it, but if you can remove the rock, you're going to have better flow of the system. So that's how lymphatic drainage is normally used under conventional settings. But we like to use it also for anybody who trains hard, really. Any serious athlete or anybody who's working out 5 days a week, really taxing their muscles. What you're doing is creating micro trauma. You're doing micro tears of the muscle with the idea that's going to repair stronger. But you do get metabolic waste. That's probably what causes some of that stiffness, the DOMS. So if you do lymphatic drainage after a workout, or maybe the next day even, you can really accelerate, or maybe I should say enhance the recovery aspect of your training and get back in the game sooner and also avoid injury. So if that's of interest to you, is staying sort of injury-free and recovering better and getting the adaptation you want faster, you want to look at your HRV, and lymphatic drainage is probably a good idea. So getting it done professionally is the best thing, but I'll go over some other options too to improve lymphatics and improve HRV. So there is a technique, I think it's called the Big Six. So if you go to YouTube, type in Big Six, maybe type in Perry Nicholson. He's the guy who kind of coined this thing. It's a way to just lightly stimulate the 6 main hubs of your lymphatic system. It only takes you a few minutes. It's pretty darn effective. So that's part 1. Part 2 is breath work. Breath work is a really powerful tool. If you're doing belly breathing, or diaphragmatic breathing, that greatly stimulates the lymphatic system as well, because one of the big areas, the biggest collection tubule of your lymphatic system, is an area called the cisterna chyli, and that sits directly underneath your diaphragm. So if you're doing diaphragmatic breathing, every breath you take is like a pump. So if you're laying on your back, you want some swelling to migrate up to the chest where it drains. Doing some belly breathing will help facilitate pumping that cisterna chyli up into that upper quadrant. Belly breathing, particularly if you're doing into the nose, out the mouth, is highly tied to the parasympathetic system. So if you put those things together, now you're getting this vasodilation of your lymphatic vessels, and you're using your breath as a pump. So if your goal is to manage swelling or improve recovery, I would recommend the belly breathing. Wim Hof breathing is a different animal. It's got a lot of great benefits, but that is a much more sympathetic style breathing. So if this is your goal, I wouldn't do the Wim Hof breathing for this. Another thing you can do is something called rebounding. So a lot of these places that have saunas and plunges have trampolines now. And the idea is you kind of just hop on it, but you're not even coming off the ground. So your toes are still on the trampoline and just kind of raising your heels. You're being kind of floppy in your body. That's a really simple way to get the fluids in your body to move around faster. And you can do this on the ground. You don't need a trampoline. It's just a little more effective on a trampoline. So that's rebounding. And we're talking about an aqueous, system. So really important to stay hydrated and have the right balance of electrolytes, because those things go together. You want the right water to electrolyte balance. Your kidneys do a good job at doing that. But what a lot of people do is replace the water after a workout, and they don't replace the salt, magnesium, potassium. So doing electrolyte in the water is a really good idea, particularly before and after a sport. And then the last one I want to talk about is contrast therapy. So this can be a little confusing for people, because doing a cold plunge or sauna, I stated earlier, can be sympathetic or a stressor. And it technically is. So there's what's called eustress and distress. A eustress, or hermetic stressor, is something that is a little bit of a challenge. And then you kind of push the envelope a little bit, and then you come back the next day a little stronger, just like working out. A distress is something that you don't really recover from well. So this is like if you just worked out way too hard, you overtrain, you end up injured. That's a distressor. So the cold plunge for most people in the sauna, the idea is to be in that distress zone. But you can also make it just more parasympathetic by making it easier. So, for me, I've been plunging for about 3 years now. So 40-degree water is pretty cold. I get in there, I kind of gasp, and I have to catch my breath. It takes me, I can do it for about 2 to 3 minutes. So that's more sympathetic. So I'll do that before workout just to kind of get the engine going. But if I sit in 50-degree water, it's pretty easy. I don't really have to catch my breath. I can get in there, get comfortable real fast. I can sit in there for 10 minutes if I want to. And the same thing is true with the sauna. Saunas are generally easier, but you can just make it not so hot. So if you do it that way, and particularly if you go back and forth from hot to cold, that can be a very parasympathetic activity. So that's a quick little overview of how you can improve HRV, use the lymphatic system, and improve recovery, and basically keep injury at bay. I wrote a blog on this whole topic, and I've got videos explaining all of the topics I just went over. So I will put a link in the show notes for the blog. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.